Hi, I'm Danny. This is my patient-centered communication tools observation video for 488. I have worked in a hospital for a little bit, so I have seen a pretty fair share of communication in the hospital setting, and I've seen good and I've seen bad. One case that stuck out to me the most was with a new employee that I was sent to observe to see how prepared they were to interact with patients on their own. We were working in an outpatient setting. I was observing, sitting at the computer, letting them do what they do. The new employee went out to go get the patient and brought the patient back in. They had the patient sit down, but they did not introduce themselves. The new employee asked the last name of the patient and the birthday, and that was it. After that, they did not speak to the patient other than, okay, yeah, and short, very quick things. When they went to go draw blood, they just started tying the tourniquet onto the patient. And the patient was like, oh, hey, that's hurting. And the new employee just was like, oh. It was not a very good interaction that I saw. They did not ask the patient any questions or ask them if they had a preference of their arm or anything like that. And for the patient-centered communication tools, they did not establish any kind of connection or introduce themselves, really. They could have improved on this by saying, hi, my name is Danny. I'm here from the lab. I just have to draw some blood from you. Do you have any kind of preference on which arm I use? Is there any concerns that you have about this? But the other thing this new employee forgot to do was ask what the patient preferred or anything. So that did miss the exploring the preferences of the patient. When the patient had mentioned that, oh, the tourniquet is hurting, the lack of interest and the lack of empathy was not a good response to this. And in the end, there was no collaboration. The new employee did not do a great job of establishing any kind of communication or connection with the patient. And I could definitely see that the patient was uncomfortable, and I did step in and talk to them a little bit during this interaction because I didn't want the patient to start to feel uncomfortable. But that's one example that's not the most fantastic, but I have seen plenty of wonderful connections. I've seen many nurses giving meds in hospital rooms, and one in particular this nurse always sticks out to me because of how kind she is to all of her patients. She walks in with wonderful spirit, attitude, and everything, and she introduces herself, asks the patient how they're feeling, if they need a warm blanket, if they're cold, how they feel, what they need. And one of the days when I was in the room, she walked in and she was giving the patient meds. And the patient was a little bit like, oh, what am I getting today? The nurse pulled everything up, explained exactly what the medications were, what they were for, and asked if they had any concerns about the medications. This nurse did a very wonderful job of establishing a connection. She introduced herself. She offered warm greetings. She offered to help the patient in any way. She was interested in learning about how the patient felt about their care and if they had any questions about their medications. She was showing true concern about the patient's frustrations with not understanding the medications or wanting to learn more. And she was also doing a wonderful job of collaborating and educating the patient. She was truly caring about if the patient was comfortable with their medications, if they understood them. And I feel like a connection like that is much healthier than making it more of a rush job, which I have seen other nurses do, where they'll be like, here's your meds, take them. But this individual nurse, she always takes the time to ask if they have any questions or if they need anything else while she's there. And I can definitely see a huge difference between how the patients react to these two different types of communication. Like with my new employee that I had, I could tell the patient was uncomfortable and wasn't receiving the type of care that they were hoping to receive. And that's not really anything you want to have a patient feel or see. But on the other hand, seeing this nurse giving meds was a wonderful opportunity to view what care should be. It makes a big difference to patients, and it makes a big difference to you and your work. I really do think that this patient-centered communication toolkit should be definitely shared a lot more. I wish I would have seen this when I first started at the hospital, because whenever you walk into your first patient's room, you don't always know what you're going to say. You don't know how to fully handle the situation. And I feel like the new employee didn't fully have an understanding of what they were supposed to do. Their ideas were, oh, I have to draw blood, so I'm going to get the blood. So I think that education can make a really big difference in how medical staff does communicate with their patients. Thank you so much for listening. Hopefully this gave a pretty good example. I appreciate your time. Thank you.